normal, but then he was outside, if the womb was infected with a cytopathic, then you have virus diarrhea or persistent infection. Any questions? Yeah.
In terms of that tolerant, persistently infected calf, you said it's going to be shedding the virus. Is it going to be shedding the non-cytopathic, or is it going to be shedding the cytopathic?
It's interesting. It'll be shedding the non-cytopathic because he was infected with the non-cytopathic.
So then all the other calves will
So then it will have the non-cytopathic virus, but when the cytopathic come and infect that calf, then you have the two biotypes, okay, which will cause the severe symptoms. Okay, now in terms of what happens to the aborted feces is that they're usually autolyzed. Do we understand what's autolysis? Breaking down of the cell. That's different from the other presentations. Mummification, stillbirth. So you have the three presentations: stillbirth, mummification, autolysis. Okay, so they're typically autolyzed, and abortion, we said that it can occur at any stage of the pregnancy, but usually in the first few days, 50 days. And when these, when there are congenital abnormality, what you find is cerebral hypoplasia, cavitation of the cerebral cortex, demyelination, eye malformation, etc. So as you see, I'm not really, reading all the clinical signs, and this is what will happen in the exam. In the exam, I'm not going to ask you about, these clinical signs in details. So what the question is going to be is, I will state the clinical sign and say, what do you think? Is this belong to this particular disease or virus, and so on. So, it's just having an idea of what clinical sign, rather than specifically each clinical sign you need to remember, and so on. Okay. Now, for the mucosal disease, there are two forms, acute and chronic. In the acute form, you'll have the necrosis of the GI, lymphoid organs, the erosions. In the chronic mucosal disease, you don't have GI lesions. So that's only the difference, between acute and chronic. In the case of chronic, what you will have is hyperkeratosis, basically skin lesions, rather than oral lesions. The diagnosis, the clinical history, and because the virus is shed also in feces and in several locations, so all the tests will aim for the virus. Basically, but you can do serology. There are antibodies that are formed against the virus. Differential diagnosis should be differentiated from malignant catarrhal fever. We'll talk about this probably in the next lecture. So basically, malignant catarrhal fever, which is also a reportable disease. It does not exist in the US. It's a serious disease which is associated again with erosions, necrosis, ulcers, and so on in the oral cavities, and other organs as well. Salmonellosis, which causes diarrhea. In case of comparison to in case of diarrheal diseases, you have salmonellosis, coccidiosis, winter dysentery that I explained earlier. Rotavirus infection also causes diarrhea. A tumor can cause diarrhea, but with a tumor, obviously, you don't have you have a slow progression. Intestinal obstruction may cause also necrosis of the intestine and so on. But when it comes to bovine viral diarrhea, it's usually, the symptoms are more, are clearer in that respect. And obviously when it comes to control management, persistently infected calf, vaccination are important. There are vaccines, inactivated and attenuated. The inactivated one, it reduces the clinical disease but not the infection. What does this mean? It reduces the clinical disease but not the infection. So what happened to the disease? Become milder. Okay. Now, the more effective, which is practiced in the US, is the attenuated virus vaccine. So this is a live vaccine. The problem, the Europeans say, well, this is not good, because if you inject with a live vaccine, you're perpetuating the infection. You will have those animals shedding the virus, and therefore you're not controlling the persistently infected animals. So what they do is they remove any persistently infected animals from the farm, and they do not practice vaccination. This is a list for your info. What are the diseases that occurs early and cause diarrhea and occurs early or later? And as you see, BVD at the bottom is a late diarrhea, because it's usually, although at all ages, most commonly between 6 and 12 months. All the others which cause early diarrhea, they're usually within weeks, the first weeks of the life of the animal. Bovine respiratory syncytial virus. When we hear respiratory syncytial, we understand that syncytium is a fusion of cells, to form a giant cell. If this happens in the lung, then obviously that is going to impair the respiration and causes problems. When you hear Paramyxoviridae family, it belongs to Paramyxoviridae family. The Paramyxoviridae family of viruses are associated with respiratory and CNS symptoms. And we saw an example of the Paramyxoviridae family with canine distemper virus. It's a large family of viruses. So the bovine respiratory syncytial virus belong to the subfamily Pneumovirinae and the genus Pneumovirus. It's most common in recently weaned cows and young cattle, being a respiratory disease, there are two things when respiratory disease are involved. One is the season. Winter is usually a problem or associated with more respiratory disease, and obviously crowding, which is associated with respiratory diseases. Now, the issue with this disease is that there are many carrier animals, which means these animals can carry the virus. The virus cannot be controlled completely by the immune system, but the immune system can control, if you want, the severity of the clinical signs. The virus being there, it means it's going to be shed. And it means can be a problem in terms of management. The disease is important and recently weaned beef calves and young cattle, particularly when maintained in close confinement. So again, crowding is very important. The same bacteria that we saw complicating, or if you want, complicating winter dysentery, is Manania hemolytica. It can also complicate this virus infection, causing pneumonia. Hence you have the virus causes the syncytium, and subsequently, if the bacteria comes, then it causes the severe outcome, if you want, of this disease. Morbidity is high, and you can see the syncytium experimentally. If you infect the calves with the virus and then kill the calf and take the tissue from the lung, you can see the fused cells in the lung. Now, for diagnosis, the virus, as I said, the animals are carriers, so that it's present in blood, and it can be isolated from blood, although this is not a reliable option. And the reason for this is because when you have carrier animals, it's likely that you have immune complexes, which would interfere with a number of tests. However, if you use things like, obviously, PCR, RT-PCR, you can overcome this issue of the presence of immune complexes. So PCR can be practiced or can be used, which is independent of antibody and antigen complexes. There are vaccines available, however, there is no consistent data about their efficacy. Any questions until now? I'm sure you're tired, but yes.
Could you explain for BBD why the test, like is an ear notch?
Say it again?
Like a BBD.
Uh-huh.
Could you explain how the ear notch test can show that a calf has BBD?
Can show what?
Ear
That
notch
the calf
test?
is positive for BBD.
Oh, but it just the blood.
Okay.
Yeah, it's present in blood circulation. Okay. This is another reportable disease. It causes respiratory, venereal, it causes abortion, and in other species than the bovine, it causes neurological symptoms. Now, when you have respiratory, venereal, abortion, things like this, things about herpes, because they usually replicate at this location and cause problem. And now, this is a section of the trachea, and what you have is a formation of a film on the trachea. This is called the false membrane. This is a false membrane, and this is basically as a result of dead cells and dead neutrophils, or immune cells, causing a film, a thick film that can obstruct the trachea, and as a result of this, a problem, respiratory problems, hyperemia of the muscles, and because of the replication of the virus in those locations, and also this is the vulva showing signs of edema. So bovine has one. It's also called infectious bovine rhinotracheitis, and as the name suggests, rhinotracheitis, it involves the upper respiratory tract. But the other syndrome is infectious pustular vulvaginitis, and that involves obviously the vulva and the vagina. Morbidity is pretty high, 100%, and mortality can be substantial. Hence, it is a reportable disease. When you have very high mortality, very high morbidity, it can be reportable. So the initial clinical signs are the signs associated with most respiratory diseases. You have the profuse nasal discharge, which become permanent if complicated, with bacterial infection. Now, why do you think the animal become hyperemic? Nasal mucosa. Why does it have, hyperemia? No answer. Or necrotic lesions. Okay. So hyperemia as a result of what? Viral replication in the site, isn't it? Okay, so as a result of that replication, you can have ulceration, which is complicated later on by cream-colored diphtheritic membrane. So this is what herpes, the bacteria, diphtheria, causes usually in the humans. A diphtheritic membrane. So this is why it's called the cream-colored diphtheritic membrane. So this is what the actual virus causes. Obviously not bacteria, because it's similar to bacteria, it's doing the same. The other sign, fetid breath, dyspnea, deep bronchial cough are common. So dyspnea obviously is as a result of the respiratory, as a result of blockage of the trachea. More specific signs, bilateral conjunctivitis. Again, with most respiratory disease you have conjunctivitis, profuse lacrimitis, and it can be associated with gastroenteritis. Abortion usually occurs at later stages, pregnancy, 4 to 7 months of gestation. This is an apply exam question, asking for which diseases occur early during pregnancy and which one occur later during pregnancy. So herpes is later, usually during pregnancy. Now the infectious vulvovaginitis, it involved the vulva, so inflammation. As a result of this, it's difficult for the animal to urinate, it's painful. If complicated with bacteria, then there'll be discharge, purulent discharge. In relation to epidemiology, the genital respiratory tract are rarely diagnosed in the same herd. So infectious bovine rhinotracheatis, infectious pustular vulvovaginitis, they're rarely, but does not mean that they cannot be present together, but they're rarely present together in the same herd. So you get either of them. It's a major significance in feedlots, again because of the crowding, the stress. The virus can be present in the semen, so it can transfer the virus. The bulls can transfer the virus to cows and causes abortion. Now we know that herpes can hide, become latent, and usually it hides in ganglia. The trigeminal and the sciatic ganglia are usually the site where the virus hides. When the animals become immunosuppressed, then the virus flares up and comes out and causes those diseases. Most infections are subclinical, and the tests that are used are tests for the presence of the virus, because it's present in nasal secretions, abundant in nasal secretions. Now, when there is abortion, you have to take care of the fetus as well. because you can take samples from the fetus. And we talk about this during the lab session, how to do that. Immunity, management and vaccination. There is a vaccine which is a marker gene vaccine, meaning that the virus in the vaccine, there is a deletion in one particular gene in the vaccine. This will help. If you remember when we talk about DIVA test, when we talk about DIVA test, an example of this, I give you the example of influenza virus vaccination, when there is a gene which is deleted, causing a protein not be present in the virus, in the vaccine, and hence it makes the distinction between a response, an antibody response against the vaccine from an antibody response as a result of natural infection. So the same thing here. There's a marker gene vaccine. This is why it's important when animal is vaccinated to read about, the leaflet about what vaccine he was given, what type of vaccine he was given. So you can recommend to the labs, whether it's worth doing testing for antibodies against the infection. Okay, I think we stop here. Any questions? So on Monday,